As a chiropractor, we look to treat subluxation. Subluxation is a fancy term that means less light or energy flowing through a group of cells or through the body. So as a chiropractor, we specifically look at the vertebra of the spine, and as the brain tries to communicate information to the rest of the body, it needs to go through these vertebrae, and it's important that they move efficiently so that they get stimulation through those areas. Now, there's 5 components to a subluxation. The first one is limited range of motion or mobility of the spine. And so we've all woken up feeling kind of stiff or sore, and that generally says that there's muscles are responding because there's a lack of motion somewhere in those joints. Now, typically in the neck, the number 2 leads to symptoms. So if you have limited motion in our neck, the symptoms can be somewhere down our arm. It might not even be in our neck. It can also be related to organs of the body, like the thyroid or the heart, the lungs. Oftentimes allergies are one of the major complaints people would have to limited motion in the cervical spine. So number 3 is related to muscle dysfunction. And so basically when the vertebra is not moving properly and it's tilted to the side, one muscle group will be tight and the other one will become weak or atrophy over time. And that's where we start to see problems with regard to decrease in blood circulation, lymphatic flow, all kinds of things. And that's when those things occur, we'll get number 4, which is inflammation and swelling. And typically that's where most people will come in to see a chiropractor when they're in pain. But what we're finding is that there's limited motion, there's symptoms somewhere in the body, and then there's muscle dysfunction happening. So oftentimes people won't come in until they get to the 4th level of dysfunction, which is pain, swelling, and inflammation. And if that continues, because of the chemistry in the body, we also see calcium flow into those joints, leading to number 5, which is bony degeneration. Okay, and so this is very often related to aging as a normal process. However, when the joint doesn't move, over time the calcium flows in there and it causes degenerative change. And so aging is only a side note to the issue. The real problem is the lack of mobility, which was the first issue. So again, lack of mobility, we have a symptom somewhere in the body, we also have muscle dysfunction, we get swelling and inflammation and pain, and then we get bony deterioration. So if you have any of these things going on, perhaps you should see a chiropractor. If you have any questions or comments, feel free to reach out and check out some of our other videos. Click subscribe below. Thanks so much.